All right. First of all, thanks so much for allowing me the opportunity to present what we're doing at Pelex. So my name is Dr. Jeremy Weigel. I'm an assistant professor of clinical urology at Cornell in New York City. And I'm founder and CEO of Pelex. We're a clinical solutions provider for pelvic health. And we're currently working on a medical device platform for treatment of disorders of the pelvic floor. Now, as a practicing urologist, definitely one of the most common sets of conditions I see are folks with pelvic floor disorders. And that's actually a broad basket of conditions that affects up to 60 million Americans alone. That means 1 out of every 4 adults in the United States are affected by something such as urinary incontinence, chronic pelvic pain, defecatory dysfunction, and even certain types of sexual dysfunction qualify. But despite this is a very large and growing problem, and there's definitely a lot of frustration in the patients that I see personally in my clinical practice in terms of the current solutions on the market. So what we've done is we've actually through dozens of clinician and potential end user interviews, we've identified actually 4 pain points in particular with respect to treatment of these types of conditions. And number one, if anyone has any, just use your imagination a little bit, these treatments can be very invasive, both in the form of surgery as well as inserted medical devices. There's actually a very large time consumption component to treatment of disorders of the pelvic floor, specifically because pelvic floor physical therapy is actually a linchpin for a large percentage of these disorders, and that requires multiple trips to a treating facility over time. In addition to that, there's both short and long-term side effects, intuitively, obviously, again with surgery, but also medications, and specifically anticholinergics, which are the class of medications used for overactive bladder, which is the biggest single diagnosis within the group of diagnoses of pelvic floor disorders. Those have actually now been associated with dementia and early death. So there's actually been a sea change in terms of treatment of OAB because of this. And then in addition, from a clinician side, the folks who are actually treating this, and I can personally attest to this because I see it myself all the time, is that there's that a lot of these folks are lost to follow-up, and that has to do with sort of the value chain in terms of treatment. People go between providers, and it can be very hard to really understand what these treatments are affecting in terms of relief of the symptoms. So what we've done is we've put together all these insights and created a product. And again, this is a medical device that addresses all these issues. So the thing to keep in mind when you're addressing disorders of the pelvic floor is that it's typically a combination of problems with the muscle function as well as the nerve function. So our device helps with both of those. So we have a non-invasive, intuitive, which is very important because a lot of the medical devices out there are hard to understand how to use, at-home device that actually has a cloud component associated with it, so there can be data tracking and the potential ability not only for the treating providers to change the therapy goals based on the feedback they're getting, as well as potentially being a research tool down the road. And specifically, so what we have here is a potential embodiment of our device. We do have a functioning prototype that has been tested in humans and does the thing it's supposed to do. And it is, so there's 2 modalities that our device encompasses. One is an active EMG-based pelvic floor muscle training module. And that's essentially the physical therapy that I mentioned earlier, only it's done at home rather than having to travel to a physical therapy office. And what that accomplishes is not only strengthening the pelvic floor muscles, which is what you need at times, but actually modulation of the function of those muscles, because not all pelvic floor disorders are created equal, and you have to personalize the therapy based on the specific diagnosis of the patient. In addition, we have a passive form, which is a neuromodulation component. And for folks who don't know what neuromodulation is, essentially pulsed electrical signals delivered to a targeted nerve to modulate the function of that nerve. It's actually an acupuncture. It's derived from acupuncture, and we have a neurostimulation or neuromodulation component as well, and it's targeting a novel pelvic nerve. So no one has tried to target the way that target the nerve the way that we're targeting it right now. So I'm sorry, I've got some kids coming in. Hold on. Sorry about that. So because of those two treatment modalities, we actually are very well positioned in what is a crowded competitor space. Our closest adjacent competitors are brands known as LV and Anovo, and those are actually single modality therapies, and they're actually more targeted as lifestyle devices. And based on our customer discovery, we found a very strong signal that people are still looking for doctors to make the recommendations on these devices. So we actually feel one of the competitive advantages we have is that we are, from the very beginning, handling this as a medical device. On both therapies, we are actually pursuing a Class 2 approval. We have our regulatory guidance already mapped out as far as that's concerned. And because we have those two modalities, we actually offer the ability to treat up to 90% of pelvic floor disorders. That's something that no other competitor can match. So again, sort of going back to those insights I just briefly mentioned, because all of our feedback is that people are still looking for the clinician to make the recommendation, even though specifically the EMG biofeedback module could be a direct-to-consumer device. We have identified our go-to-market strategy as being one where we win the physician recommendation. So the clinical champion is the urogynecologist and the urologist and the gynecologist. And then they make the recommendation to the patient, who then goes to the e-commerce channel to make the buy. And this is the initial go-to-market strategy for our first technology rollout, which again will be the EMG biofeedback module that does not require a physician prescription. So our beachhead market we've identified as the 40 to 60-year-old women who are postmenopausal and or postpartum, who are suffering from urinary incontinence and or pelvic organ prolapse. Once we've established a foothold in that beachhead market, then we can grow into the entire market, again, because of our multimodality, and that's represented by the purple column in the middle, and that's actually a multi-billion-dollar opportunity. So we've done a lot of projections in terms of revenue after launch. I'll talk about our timeline on the next slide. But these are revenue projections based on obviously certain assumptions in terms of sales modeling, just for our beachhead market and just for the initial EMG biofeedback technology rollout. So even within that very confined space, as a part of the entire pelvic floor disorder space, with low adoption rates, we have $50 million in revenue 5 years after product launch. And with high adoption, it's $200 million, close to $200 million. And again, that's just for that specific beachhead market, that specific technology. So this is our timeline. We're essentially halfway through this right now. Like I said, we've got a human tested prototype. We're actually literally, I just had a call today, we're assembling our prototypes for the first clinical study. And assuming that we hit all our timelines, which obviously is a big assumption, we're planning on having our FDA submission ready at the end of 2021. That includes a clinical study with potential approval and market entry at the end of 2021, beginning of 2022. I should mention that we do have IP both we are pursuing both design as well as utility patents. We've already filed those. And currently we have around $50,000 in both like friends and family, as well as prize winnings that are funding us. We are currently raising our seed round. This number 2.4 million gets us to our through our FDA submission up to our verification and validation testing. It puts all of our best practices in place for actual manufacturing, does the larger clinical study, which will be an FDA submission, will be a roughly a 50-person study, and also allows us to do some initial marketing and branding exercises. So finally, we're very excited about our team. So just as a little bit of background, I actually started thinking about this and designed an initial prototype close to 7 years ago now. But I've only, for the past year, been able, we incorporated in March of 2019, and I've been able to build, we've been able to put a team together that has decades of experience in both clinical and consumer marketing, as well as medical device product management, and development. So we are very confident that we have everything in place to take our idea from concept to commercialization. And that's us, that's Pelex. Thank you so much.
Excellent. Thank you. Thank you. Sasha, I see you turned your mic on. So you want to go first?
No, I'm never going to do that again. I will go first and probably ask a stupid question, but you know, as Steve can attest, I wasn't great at science in high school. So this is a medical device kind of. What stops this from being applied to other disorders and things like that? Why is it so bespoke to the pelvic floor disorders?
You're speaking about the biofeedback as well as the neuromodulation?
Yeah, I mean, at a high level, you're creating a device that monitors feedback and stimulates nerves, as I took away from, and you know, with my basic understanding of human physiology, that could apply to many different things, I would think. Is there? Oh
yeah, absolutely, and it is definitely, and that's part of the reason why our IP definitely involves the design patent, because the way to sort of unpack this a little bit is that in the two technologies, the EMG biofeedback actually has a very large body of evidence surrounding it already. So what we're delivering is not new therapy, we're delivering it in a novel way. And the reason is because typically when you have a physical therapist sort of taking someone through these types of this training, and sort of the simple way to think about it is Kegel exercises, but it's actually much more complex than that. And believe it or not, even Kegel exercises, 50% of the population will do them incorrectly if you're not shown how to do them. So that is actually accomplished either through invasive medical devices that are inserted, you know, into body cavities, or is done with a physical therapist literally telling you, touching you on your body, saying, you need to squeeze here, you need to squeeze here. So we've actually been able to overcome that through the design of the patient interface. And then as far as the neuromodulation is concerned, that is an insight that came from me. So I am a reconstructive and pediatric urologist, and one of the most common local nerve blocks that we do is something called a Pudendal Block. And that's something that renders all the genital skin completely numb. And it's only accessible in a certain position. And I realized, and talking with my anesthesia colleagues, that the way that we're actually implementing our EMG biofeedback also allows us to access this specific nerve in that anatomic position. It's essentially a sitting position. And there's no way else to do that. So although people have tried to access this nerve percutaneously by putting tines through the skin down into the area, And I would actually have to have probably an anatomic model to really fully explain how this works. There's no way to reliably access that nerve either percutaneously or what we call transcutaneously through the skin, except in the way that we're doing it. And so we're the first people to do that.
Thanks. That's very helpful.
Jeremy, the FDA regulatory stuff on these medical devices always seems to confound startups. If you guys end up having to be a lifestyle device and not end up with FDA approval, is that problematic for you?
No, I listen. In the end of the day, we want to be able to help people. Like we've got there's no sort of like ethical compunction as far as that's concerned. But what I would definitely say is that in all of our customer discovery, again, like if we come in as a lifestyle, and quite honestly, like I said, those people who are most adjacent to us is definitely what they're doing. I mean, I don't know if anyone's aware of Elvie, but that is a lifestyle brand. And that's great. I mean, that's a very impressive company, but that's not the space that we think we're most competitive in. And especially because the neurostimulation component, again, based on our regulatory guidance, will require a prescription, at least initially. And what we're thinking is like sort of a pharmaceutical model where initially you need a prescription, but then you can roll that out into a direct to consumer once we've got enough sort of safety data accrued.
Excellent.
Thanks.
All right, and I just have one quick question. So what's the feedback loop with the clinician?
So we've done a lot of sort of work on what we think essentially what a platform could look like in terms of our product. And quite honestly, we think that's potentially the most promising out of everything that we're doing, because this is actually a very disorganized space right now. You have a lot of people, you have pelvic floor physiotherapists, you have urogynecologists, but no one's really talking to each other very well. And one thing that we've actually thought about is something along the lines of a Peloton model, where you have the device is how people get into the ecosystem, and then they have access to coaches and other sort of care providers through that. Now that's the pure just sort of like treatment space. As far as research, it's actually something that is very straightforward. So a lot of anyone who does research on this topic knows that one of the problems that we have is we don't have granularity in terms of the day-to-day changes in people's pelvic floor. And that's actually one of the things that we can accomplish, because this is something that someone can literally just throw on their bed after a shower or on their toilet seat or something like that, and interact with it for a few minutes every day. And that's going to give a wealth of information in terms of what's going on with respect to people's pelvic floor. Because again, this is it's a very person-specific treatment regimen that works best.
Super.
Thank you.
Okay, Jeremy, thanks so much.
Thank you. Thanks for the opportunity.
Absolutely.